July is Sarcoma Awareness Month, a time to raise awareness about bone sarcoma or primary bone tumor. This affects a small number of people each year. Bone sarcomas are seen most often in young people, typically between the ages of 10 and 30. They can feel like a sports injury or growing pain, especially if it doesn't go off in 2 to 3 weeks. Pain that is especially worse at night or during activity. If these symptoms do persist, then it is important to investigate it early. Hi, I am Dr. Anil Kamath. I am a senior consultant surgical oncologist at Therrapie Healthcare. July is Sarcoma Awareness Month, a time to raise awareness about a rare cancer that often goes unnoticed, bone sarcoma or primary bone tumor. This affects a small number of people each year, but when it does, especially in children, teenagers, and young adults, early diagnosis can make all the difference. What exactly is bone sarcoma? Bone sarcoma is a type of cancer that begins in the bone. It is a part of a larger group of cancers broadly called sarcomas, which arise from the connective tissue in the body like bone, muscles, cartilage, and fat. When sarcoma begins in the bone, it is considered a primary bone cancer, different from cancers starting from elsewhere and spreading to the bone. The most common types include osteosarcoma, which is usually seen in adolescents, Ewing sarcoma, which can start in the bone or soft tissue. The tumors can grow rapidly, which is why recognizing early symptoms and signs is most important. Bone sarcomas are seen most often in young people, typically between the ages of 10 and 30. They may be associated with certain inherited conditions or prior exposure to radiation. In some cases, they are diagnosed in older individuals as well. Regardless of the age, the key is knowing what to look for and acting promptly if the symptoms persist. What are the symptoms of osteosarcomas or bone sarcomas? Bone sarcomas can be tricky to identify early because the symptoms are easy to miss. They can feel like a sports injury or growing pain, especially in younger people. So look out for bone pain, especially if it doesn't go off in 2 to 3 weeks. Pain that is especially worse at night or during activity. Swelling or a noticeable lump near a joint or a bone. Difficulty in moving a limb normally. Fractures that happen with very little force. Of course, it's important to know that all these symptoms point not necessarily towards bone cancer. It can even be due to other conditions. But if these symptoms do persist, then it is important to investigate it early. So how does an oncologist establish the diagnosis of a bone tumor? So if we suspect a bone tumor, it usually starts with the X-ray, which gives us a broad clue what we are dealing with. But this is usually followed up by a MRI to look at the full size and structure of the tumor, a CT scan, especially of the lungs, to check for spread, and finally a biopsy where a small sample of the tumor is taken and analyzed. Getting a clear diagnosis early means that we can plan the treatment more effectively. So how are bone cancers treated? Now, like in most cancers, there are broadly 3 treatments available. Surgery, which is to remove the tumor. In most of the cases, we try to save the limb, and in most cases we are successful. Chemotherapy and radiation. Newer treatment therapies like immunotherapy is being investigated for these sarcomas. For most patients, surgery and chemotherapy remain the mainstay of treatment. Thank you.